I'm Dr. Gunjan Jain, working at Jain Fertility and Mother Care Hospital. I'm the director here, and our main specialty is infertility, but we look after all women at all ages for any kind of problems. What brings you here?
Actually, doctor, I'm 32 and I'm at the peak of my career. So I'm not yet planning a pregnancy, but I would definitely want to have children in the future. So what kind of options do I have?
Absolutely, you have a lot of options, beta. But have you ever heard of egg freezing? There are so many patients these days who want to know about egg freezing. And do you know who they are? Some are unmarried girls who don't want to get married even till the age of 35, but yes, they want to have children later. There are so many married couples who are both working and they can't afford to have a child right now, so they want to postpone their childbearing. There are young girls sometimes who are going through some kind of chemotherapy for some cancers, so they want to have a egg preservation so that they can have their own kids later. These are the main indications why egg freezing is so popular these days. So if you think you are the right candidate for freezing your eggs, you must consult your doctor. But before that, you must know your eggs. Do you know that at the age of 20, the 90% of the eggs are normal, and at the age of 40, 90% of the eggs are abnormal. So eggs keep on aging with your age, and if you are in the middle, say somewhere around 30 to 35, you may have enough good quality eggs. But if you are nearing 40, you may not have good quality eggs. So you have to understand this principle and then decide as to when you want to freeze your eggs. So after you've seen your doctor and it has been decided that you will need egg freezing and you are the right candidate for egg freezing, your doctor will order some hormonal tests and maybe an ultrasound exam just to know what is the quality and whether you can get enough eggs or not. So once this is done, then the actual process of egg freezing will start. So, what is the actual process that you have to go through when you decide to freeze your eggs? Your doctor will call you around the second or the third day of your cycle. And normally, only one egg is produced in one cycle, in one menstrual cycle. But here, because we want to freeze the eggs, we want enough eggs to be frozen in one cycle. So, you will get some hormonal stimulation in the form of injections, and this will help in making more than one eggs. We may get 5 eggs, 10 eggs, 15 eggs. So once the follicles are mature, which is understood by doing a ultrasound examination and some blood tests again, you will be given the final trigger. Now this trigger is for the final maturity of your eggs, and around 36 hours after that your eggs will be withdrawn and taken up for storage. So egg retrieval, that means removal of the eggs from your ovaries, is done under ultrasound guidance. It is not a painful procedure because anesthesia is definitely given during the procedure. So you are taken to the operation theatre, and under ultrasound guidance through the vaginal route, a needle is passed into your ovaries and all the eggs are withdrawn. So eggs are withdrawn from the follicles that have been made, and each follicle may contain one egg, and we retrieve the eggs from each follicle and they are seen under the microscope and then taken up for storage. Always remember that everything comes with its own risks. So it is never a replacement for a natural conception. If you have frozen your eggs, you should not be 100% sure that you are definitely going to have a baby, because conception may not happen after transferring the embryo that has been made out of your frozen egg. So do not mistake it as a very sure shot procedure. It is not a replacement, it is only a backup procedure.